Today, I'm excited to be joined by Sharon Eva, an occupational therapist and expert in the area of facilitating neurodiversity-affirming play in children with autism. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. This is part of a group of episodes that address play, so I want to recommend that you check out the episode with Dr. Thomas Morgenthaler on play spaces and a future episode with Dr. Brittany Savers on toys and play. We also have another episode focusing on the CERTS program and autism with Dr. Amy Laurent. I also highly recommend our second episode with Dr. Wendy Staub on occupation-based practice. We are here to support our amazing community of therapists, and we hope you find these related episodes meaningful.
Welcome to Pediatric Pioneers, a MedBridge podcast where we conquer challenging topics for the pediatric therapist through conversations with pioneers who have blazed new trails in our practice. Our aim is to deliver actionable takeaways for practitioners like you. To receive continuing education credit for this episode and access bonus resources, make sure you check out medbridge.com. Hello, I'm your host, Nicole Quint, and I'm an occupational therapist with over 20 years of experience in practice and academia, specializing in pediatric practice and the improvement of occupational participation and performance through my expertise on executive function, visual perception, social emotional learning, sleep, and sensory processing. It is my passion to support pediatric therapists like you so that you can best serve the families under your care with evidence-based practice solutions, easy to implement advocacy approaches, and new ways to lean into your skills within the challenging pediatric landscape.
Welcome, Sharon.
Hi, thank you for having me.
Thanks for joining us. Could you get us started by sharing a little bit more about yourself and how you are involved with neurodiversity-affirming autistic play?
Yes, so I began my career in pediatrics, and my specialization and passion have always been related to the intersection of sensory processing and mental health in neurodivergent children. And then more recently, over the past few years, I've been adding autistic adults as a primary demographic, such that my dissertation is actually related to meaningful engagement and well-being in autistic adults. But yeah, my origins and the spark that got me into this field was serving kiddos with autism. And over the years with the strength-based movement, I found that there was such a need for pediatric OTs to move away from medical model practice and then towards neurodiversity affirming practice and the strength-based model, where we really question our own biases about what these kiddos can or cannot do and focus more on facilitating meaningful engagement and well-being so that these kiddos can become well-adjusted adults. And since play is the primary occupation of a child, that's one of my main focuses for intervention.
Yeah, I mean, this is really an exciting topic. I think it's so important. I know this session today is not about adults, but I think that's really exciting and an area that we need to consider because they have a really hard time accessing services. So maybe we'll have to add that in the future. But I do want to talk more about this topic in terms of this is a shift, right? And I know a lot of therapists have been practicing in this way, but this is a shift away from the medical model that I think is something that we just really don't fit into nicely. So why do you think it's important to discuss neurodiversity affirming autistic play? And what questions should we be asking ourselves as practitioners who work with this population? What should we be questioning?
Yeah, so really this whole movement is kind of going back to the roots of occupational therapy, and the goal of OT is to facilitate engagement, right, in meaningful occupations. And the meaningful occupations of neurodivergent children is play, and the meaningful play of, their authentic meaningful play has often been ignored and kind of cast aside to mold them to more neurotypical standards, and that's not really what OT is about. So, yeah, I have three questions that practitioners can ask. So, the first is, am I focusing on my patient's autonomy, competence, and relatedness by facilitating strengths and interests, or am I only focusing on remediating their weaknesses? And the second is, am I offering activities and choices that are related to their strengths and interests? And the third is, am I using strength-based language to reframe mine and the caregiver's perspectives?
And I know throughout this, these are really important questions. And as I'm thinking about this, I really wish I would have been doing this 20 years ago when I was, working with children that fit in this population. We weren't really thinking this way necessarily. But I also want to say that, words have power and meaning. And I know sometimes we might say patients, sometimes we might say clients, sometimes we might say our pediatric partners or our kiddos. So throughout this, we'll probably be kind of threading in some of that because there's lots of different ways to say it. But what I think is really interesting here is you're using that word reframe, right? So the action is really we're reframing how we think, how we talk, and how we're working with these kids and their families.
Yeah, absolutely, and that's what the strength-based movement is about. It's an entire paradigm shift, and it's really about
Mhm.
it starts with our thoughts, right, and our behaviors and our language that we use, and like you said, reframing them to be more positive and to give out more hope.
Oh, yeah, hope is powerful. I love that. So I know there has to be research to back this up. So, what does the recent research say? Can you give us some of those highlights about this movement?
Yes, I love getting into the research and into the history, so first we're gonna share a little bit about the history of the term neurodiversity and just the movement in general. So, what first spurred all of this change was the positive psychology movement around the turn of the century, 1998, with Martin Seligman. And then shortly followed by that was the theory of self determination by Ryan and Deci in 1999. And the self determination theory is a meta theory for human motivation, and it outlines three core psychological needs that every human has, and those psychological needs are for autonomy, competence, and relatedness. And so, following that came the strength based movement, and OT, occupational therapy, kind of echoed this movement and adopted it as our own with strength based frame of reference, which is published in the most updated frames of references book. So, the strength based approach states that every human has intrinsic strengths and interests, and we should be using these strengths and interests to drive intervention and be cultivating them instead of only focusing on remediating deficits. And so the neurodiversity movement has stemmed from that. And so the neurodiversity movement just relates it to people who learn and process information differently. So within that umbrella is autism, ADHD, OCD, bipolar, and then learning disabilities like dyspraxia. And so if you're interested in learning more, the listeners interested in learning more about the specific tenets of neurodiversity affirming practice, I left a citation in the bibliography. But to share some of the neurodiversity affirming tenets, some of them are to involve the autistic individual and their caregiver in creating the goals,
Mhm,
to learn about the ways that they communicate, and really to just acknowledge that all behavior is communication. So even if they're non speaking or nonverbal, it does not mean that they're not communicating, right?
mhm,
And also to honor their preferences and their behaviors and their ways of communicating. So, for example, a quick example is if you notice that you bring a kiddo into the session and they're trying to elope from the room, or they're just unable to sit at the table, then instead of trying to redirect them towards the table and keep forcing them to do your predetermined activity, maybe you need to change the environment because it's overstimulating, or change the task itself, or change the way that you're interacting with the child. Maybe you need to get quieter and softer. Um, and maybe they can be more engaged if the lights are dim or off. And you need to change environments entirely. So it's important to problem solve and think critically in the session itself. And another tenet is moving away from seeing these different ways of learning and processing information as a deficit or bad. Like, for
mhm,
example, with eye contact, so many autistic adults now say that they actually are able to attend better and listen better if they don't make direct eye contact with you. But so much of our interventions have been to make eye contact, right? But that's just not functional for them.
mhm.
So finally, the last tenet I'll speak about is just prioritizing choice, autonomy, and self determination in the patients that we serve.
Mhm. Well, you said that the 3, the autonomy, the competence, and the relatedness really fits into these tenets that you're talking about, but when I hear you speaking about these tenets, what I'm hearing is, yes, it's strengths-based, it's client-centered, but it's really our path to occupation-based practice and seeing these children as occupational beings, right? You have to understand what they want to do, what they enjoy doing, and we typically, um, enjoy things that we're good at.
Yeah, exactly.
Right? Those are the
Mhm.
things that bring meaning to us. So, I think it really leads us to authentic occupational therapy, which is super exciting. So I really love these tenets and the language involved. Um, so how does this fit into play with neurodivergent kiddos?
Yeah, so with play, we all know that it's the primary occupation of a child, and that includes the autistic child as well. So just briefly about play in general, there is no agreed upon definition across any discipline on what play is, but we can define it by its characteristics. So, some of those characteristics are that it's joyful and that it creates positive emotions and that it's intrinsically motivated and self directed and that it's active and that it's meaningful. So, if we know all those characteristics, we should be looking at our interventions or play interventions and making sure that they align with those characteristics and that we're seeing that, in our autistic kiddos that we work with. So, we need to know that motivation is an essential precursor to performance and engagement in occupations. That's part of the strength based frame of reference. And so, part of the research now on autistic play, well, really quickly, let me backtrack. There are three cognitive levels to play. The highest form of play is pretend play, which is, your imaginative play. And then goes functional play, which is using an object for its intended purpose, like racing a car back and forth, bouncing a ball. And then the first type of play is sensory motor play. And this is, often what we see little kiddos doing where they mouth objects or they're just really interested in the sensory features of a toy. And research has overwhelmingly shown that autistic kiddos could not care less about pretend play. It's not meaningful to them and it's difficult for them. And they really love sensory motor play and functional play. So if we know this, then why are we focusing so much on trying to build their pretend play repertoire, right? And like trying to get them to engage in pretend play when it's not really their preferred method of play and it's not meaningful to them.
Right. Yeah, that makes sense. Full disclosure, I mean, I can remember working on imaginary play and functional play with kiddos who had no interest. And if I would have just stayed in that sensory motor, I probably would have gotten a lot further. So I'm glad that we're learning a better approach.
Yeah.
I'm curious too with what you were just talking about. That there's no agreed upon definition about play, but we do have this step ladder, if you will, of play levels,
Mhm.
right? Um, and you said we're moving away from fixing or remediating. So we're trying to really focus on what's meaningful to them. And so it sounds to me like with the motivation and all these things that you're talking about, we're trying to really focus on maybe staying in sensory motor and building other things through that sensory motor play because that's where they're happy, that's where they're experiencing the joy, and that's what's meaningful to them.
Yeah, exactly. And it kind of does depend on the outcomes that you're trying to achieve, right? But I think a lot of our outcomes with these kiddos has been to try to fit them into a specific mold. And
Mhm.
then, they might have a meltdown or a tantrum because of all these factors that we're trying to force upon them. And instead, it's more about, reframing and flipping the script and observing, seeing what brings them that joy. And most importantly, what brings them that meaningful engagement. Because
Right.
engagement is the precursor to being able to work on any other skill.
Right. It's not we don't want to skip over the participation part of it, the engagement to get to performance. Sometimes
Exactly.
it's okay
Well
to
said.
stay in the participation engagement. I like that. Yeah. So let's talk about, you have this research. How do we translate that research into practice?
Yeah, so I feel pretty strongly about this just because I've seen, what a difference it can make, but I think it's so important in the initial evaluation for occupational therapy practitioners to observe the child. Of course, we know that, but then to know and understand what their strengths and interests are. And if you can't necessarily observe it, if the child's having an off day or whatnot, then you need to ask the caregivers that they came with. What do they like playing at home? Like what types of activities do they and occupations do they engage in at home? And document that, and that's what you will use. But along those lines, it's so important to, even in intervention sessions, to just observe the child, be a little bit slower to intervene and observe that child in that environment and in their context, even just for 10 seconds. We can count all of that as useful data because it's really easy to, go into your session with your activities, with your little basket and feel hurried. And especially if the parent is there, we feel kind of an urgency to check off our activities and our goals. But that risk is then missing potentially meaningful details. So we want to wait just even a few seconds before intervening, allow opportunities for co regulation, allow opportunities for you to imitate the child, and just remember that all behavior is communication. And also, if the parent is in the room with you, which is awesome, what I do is I narrate my thought process to them. So I'll say, okay, let's call this child Johnny. Johnny's in the room. I'm just going to watch him for a few seconds and see what he gravitates towards, and then I'll intervene. And when you bring the parent into the session in that way, they feel way more confident in what you're doing. They feel calmer. They feel part of the session. They are more engaged, then they can take your strategies that you're utilizing and bring them home because that's a big point is parent education and generalizing these skills, right?
Yeah, that narrating is so important. And it also really helps you, it's validating what you're doing as well.
Right. Yeah.
That's a really important thing as well. Um, so I'm curious, I like this idea of kind of sitting back a little bit, observing them, letting them do some free play, no matter what their free play is, right? Without worrying that we have to go in and necessarily intervene so we can truly understand what they're doing, how they're regulating all these things. You know, but I think there's probably a little bit of pushback to this approach, right?
Yeah. So yeah, and the pushback is, it's justified, but I will say, a lot of the pushback is related to parents and other practitioners saying, "Well, we need the child to be able to sit still. We need the child to not rock back and forth in public, and they need to be able to listen and follow directions." And yes, of course, all that is true.
Mhm.
But how do we help them to be able to listen to others, and how do we help them tolerate sitting for periods of time? How do we help them become happy, well adjusted adults? Is first listening to them and learning about their regulatory needs and learning about the reasons for their behavior and learning to see, their ways of communicating and being in the world as meaningful and purposeful. And when we have that engagement and when we have that trust and rapport with them, then we are able to work more on attention and all the other skills.
Mhm. Yeah, and I again, I understand the pushback, and there is maybe a sense of urgency to it. But that attunement is what we're really good at as occupational therapy
Mhm.
providers. We have that ability to have that rapport, and so we want to lean into that. Um, so what do practitioners need to consider when we're thinking about the perspectives of the others who are involved? Whether it's the clients, the care providers, do you have some recommendations about certain talking points, or we were saying earlier that words kind of have a lot of meanings, that we want to choose wisely, or different strategies that you would suggest to aid in that buy-in and the carryover, especially when there is that potential for pushback.
Yeah, yeah, so you mentioned the way that we talk and the language that we use, and I think that's huge. So the way that you talk about the child to the parent and even in your documentation really
Mhm.
does matter because it shapes your own judgments about the child. So, imagine if you're a parent and you hear only deficits about your child, right? You go into an initial evaluation and then the practitioner says like, okay, this is what I'm seeing. Johnny has deficits in X, Y, and Z. We're going to be working on remediating those skills. It's like, okay, yes, that might be part of the purpose of OT, but that's sad to hear about that only bad things about your child, right? And we want to provide hope to the parents and help them also see their child's strengths. I think parents often need that encouragement
Mhm.
more than we realize from practitioners to help them see their own child's strengths and interests and to use that. So, a few examples of what strength based language looks like. So, I think I'll first say the deficit based language, which is the language that we often use in our documentation, and how we can then flip that to more strength based language.
Okay, great.
So, one of the statements might be child demonstrates deficits in sensory processing and regulation and engages in non functional behaviors such as rocking and stomping, right? So, we're already using the word deficit.
Mhm.
We're using the word non functional behavior, which now we know that all behavior is communication and we can see it as functional.
Mhm.
So, to flip that into more strength based language, we could say child demonstrates sensory processing and regulation challenges, but displays adaptive behaviors to overstimulation with regulating vestibular and proprioceptive input, such as rocking and stomping. So, with that, we're giving kind of a new light to their behavior, right? Rocking and stomping for them might be regulatory and it's vestibular and proprioceptive input, which is our bread and butter as OTs, and we can work with that. So, another one is the deficits based language would be child displays significant difficulty with transitions between activities and engages in tantrums during schedule changes. Again, that's very negative, very deficits based.
Mhm.
We can change that into strength based language by saying something like child benefits from a visual schedule or whatever the strategy might be to
Mhm.
ease anxiety during transitions and unexpected changes. So it's a little bit more gracious of, a definition and it provides problem solving. So we're solving the problem of the transition challenges by using a visual schedule to ease the anxiety.
Mhm.
And lastly, another example of deficits based language would be child displays significant deficit in divided attention skills with a limited play repertoire, playing stereotypically with only 1 to 2 objects. This is one I've seen, all the time.
Right. It sounds familiar.
Yeah, exactly. Sounds
Mhm.
familiar. But we can flip that to more strength based language by saying something like child has focused interests and ability to sustain detailed attention to their interests. And
Mhm.
child's interests are a potential future area for engagement and employment.
Mm. When I hear this, and I love these examples that you provide, it's very helpful to hear, this is sort of the deficit focused language. And then here is how we can transform that or reframe that into this strengths based approach. When I hear it, I hear a couple things. When I hear the first examples, that's a laundry list of deficits and you start plugging those together and it feels we were talking last night about some of these words that we use and we were talking about barriers and barriers sometimes can feel insurmountable. And so when you start getting enough of these laundry lists of deficits, it can feel like where do I start? It sounds a little insurmountable. How am I going to get
Mhm.
this child to be employable? Right? But
Right.
then when I hear the way that you transform them through the strengths-based approach, now they sound like challenges, but I know where to go with it.
Mm,
And so I feel
100%.
like that is super helpful to me when I'm treating because now I know where to go instead of feeling kind of like, where do I start?
Yeah, I love that. It provides a little bit of hope to the OTPs out there too, which is
Uh-huh.
sometimes what we need.
We need that as well, right?
Yeah.
And so you know, again, this just reinforces that idea of that meaningful engagement. And now you can do a top down approach. I can say I'm starting with the occupation of sensory motor play, but I could add in there, I want that regulation piece. And now I can go through and do my analysis. I have my occupational analysis. I can look, say, what can the child do? And
Mhm.
then now I see where there's some gaps. I know where to go. And so I think this, like you said, this brings hope not only to the families and the child, but it really brings hope to the therapists that are to working with kids that do have laundry lists of things they need to work with.
Right.
So I like all these practical things that we can bring into the clinic space or the school space or the home space or even the hospital space, because I know we treat children all over the place. So we really like to talk about actionable takeaways. So we really get that maximum impact. So, what would be your top three actionable takeaways for practitioners to put into practice using this approach?
So I actually have 4, if that's all right.
That's
But,
fine.
so the first would be to find the autistic child's strengths and interest in the initial eval, as we, talked about before, and then utilize them throughout the interventions as a way to design and drive the intervention. So instead of using a child's interest or reinforcer as a reward for displaying a certain behavior, use it to design intervention and cultivate those interests and strengths. So, for example, if a child is really into cars and trains, don't just give the child cars and trains as a reward for completing your lacing activity. Design your fine motor intervention all around cars and trains.
Mm,
That's such a rudimentary example, but making that switch is so powerful.
mhm,
So, the second takeaway would be find ways to facilitate self determination by creating opportunities for autonomy, competence, and relatedness. And just to give a brief definition of the three, autonomy is all about choice, um, giving the child the choice in activities and the ability to be independent. And then competence is being successful in a task. We want our children to feel like they can succeed. And then relatedness is that sense of social acceptance and belonging. So, the third takeaway would be take a moment to pause during the sessions and really just be with the child. We want to create a safe space for them within their environment and within ourselves, right? Like, it's really important for us as OTPs to be regulated ourselves so we can practice co regulation. And then also take a moment after the session to reflect on areas of success and opportunities for growth. So what went really well in this session and then how can I improve for the next session with this kiddo? And along with that, I always use meaningful engagement and regulation as goals so that they are functional and that they can be functional. So I'll provide a couple example SMART goals that we can use.
mhm,
One SMART goal is for meaningful engagement is patient will display meaningful engagement in 3 self-chosen activities as evidenced by engaging in that activity for X amount of time or by displaying positive emotion. And then a regulation SMART goal could be something like patient will display regulated behavior as evidenced by displaying calm behavior when engaging in activities of choice.
mm. Yeah, those goals are helpful. Now, I earlier I said, go back and listen to Wendy Staub's episode on occupation-based practice. She would probably tell us we need to say occupation instead of activities. That would even take it to the next level.
Yes,
But
yeah.
this is really helpful because goals can be kind of tricky sometimes. And if you're coming from that deficit-based approach, I think it gets even trickier. So I almost feel like the strengths-based approach it definitely makes it easier to write goals, but I like how you're really focusing on that meaningful engagement with the goals, because when I hear that goal, um, it, they're broad enough to where they open up opportunities for you to work with the child, but they are really working on specific things that are going to be really helpful moving forward.
Exactly. Yeah. And sometimes, this is like a really good stepping stone and starting point, right? Like we were saying,
Mhm,
meaningful engagement is the precursor to any other skill. And
mhm,
so there are some days in a session where you're planning on working on all of these higher level skills, but the kiddo's just not having it that day. They're having a hard day. They just had a, full day at school and then they come to your session in the afternoon and it's a lot for them, to have more demands placed on them. And sometimes you do just need to pare it back to how can I get them regulated and meaningfully engaged?
mhm.
And if you have those embedded as goals already, there you go. It's easy.
You send them home that way, mom and dad are really happy.
Yes. We want our kids to leave sessions happy. That is
Right?
so important. Yes.
So you said
Yes.
you had a fourth um, example as well, or takeaway.
Yes. So the fourth
Okay.
takeaway is that environment really matters. So everything in the environment should be intentional to the extent that it can be. So reduce distracting toys or equipment, dim those lights or use natural lighting. And what I would do is take 20 seconds to set up the space beforehand. It takes way less time than you think it does, you know, by placing activities and toys around the room. And then instead of trying to get the child to engage in like my task or in my occupation, I then allow the child to enter the environment, take the space in, and then let them choose the activity or the occupation by observing what they go towards and gravitate towards that session. And then I design the entire session around that. So then I can facilitate autonomy and choice.
Mm-hmm. Yeah, and that makes a lot of sense. I just spoke with Thomas Morgenthaler, and he was really talking about how important environment is and the play spaces that we work with children. And, we're limited by this clinical environment. So you have to make use of where you're at a lot of times. And I think this approach really could be easily overlooked, but it's so important. And I know you and I were talking about a little bit of the idea of if you have older children that you work with or children who maybe are trying to work on thinking about helping others, you could have them help you kind of create the space for the next session. They could think about the kid and say, oh, they might like this or this, and they could help you set it up, which is also kind of cool because there's a lot of evidence that says helping others is really beneficial for our tween friends,
I
that we
love
work
that idea.
with.
Yeah,
So, but I like, you go back to this idea of autonomy and choice, and the relatedness piece and the confidence, having those three things in your head when you're thinking about the environment, when you're thinking about taking that pause, when you're thinking about all of these things that you're recommending, I just keep hearing those three words. And I really think if you keep those kind of right here as you're treating, they will really guide you the right way.
absolutely. Yeah, that's a good idea to have that at the forefront of your brain and of your mind.
Mhm. So you've given us some really great advice. We kind of know, I love that we know the history as well. Um, so can we help the audience that's listening by talking through a couple of, hypothetical but still applicable examples or case scenarios?
Yeah, absolutely. So I'll go in depth into one kiddo. We will call him Matthew. And he is a 4-year old diagnosed with autism, minimally verbal, but he did some scripting and some echolalia. And very active kiddo, loved moving around and just had a hard time attending to activities. And so, when I first started working with him, some of his goals were generally around being able to reciprocally engage or display joint attention towards an activity. And then another was to be able to throw a ball 6 feet as a gross motor goal. And then another was an attention goal. So being able to display focused attention towards an activity for at least 3 to 4 minutes. And at first, I worked on those goals from a bottom up approach, meaning that I worked on remediating those specific skills. So we'd
Mhm.
work on attention towards an activity that was chosen by me, let's say lacing around a lacing board or coloring or, block stacking, whatever it might be. Um, but as you can imagine, that was not working super well. It never went to plan. And he kind of end the sessions just having meltdowns and having a hard time with transitions. And so, what I did to make it neurodiversity affirming and more strength based, and again, to really facilitate that meaningful engagement, was approaching the sessions more top down. So, before the sessions, I thought, okay, how can I engage Matthew in a way that is meaningful to him? How can I get him to engage with me, to the environment, with the occupation of play? So, I came in with my ideas and activities, but as any pediatric therapist knows, it our sessions never go to plan, and we have to be flexible and know how to pivot. So one day in one of our sessions, he was showing an interest in a couple things that day. In running around, he had no interest in sitting at a table that day or in staying still. which I wanted to honor, right? Because forcing him into a chair would only lead to a meltdown.
Mhm.
And the other thing was that he was showing a real interest in gravitating towards the bouncy balls that I kept in one of the corners. And so I let him engage with the bouncy balls. I just observed him for a minute and just let him, and I was trying to see like how he was engaging with them. So he would hold one of the bouncy balls in front of his eyes and kind of twinkle it and then watch it drop. And he would do that over and over again and just giggle. And he just was so tickled by this experience. And so I knew that he was experiencing joy. And I knew that this was intrinsically motivated.
Mhm.
And I acknowledged then and there, okay, well, this is what we're going to be doing right now, not the color sorting activity or the lacing activity. So, thinking that I wanted to connect with him in this interest area, what I did was position myself in front of him. And as he dropped the ball, I would be there to catch the ball. And every time I caught the ball, I would say, I got the ball. And he would make eye contact with me and we would connect and smile at each other in that moment. And that was the moment that I was looking for. That's that meaningful engagement, right? That
Mhm.
reciprocal engagement. And then once I had that, I was able to slowly expand the task to dropping the ball into a bucket and chasing after it. And, so then he can get his wiggles out too. And then practicing rolling it back and forth to each other. And then finally working on the goal of throwing the ball 6 feet away to practice those coordination skills. And we did this activity for over 10 minutes. And in this way, this one activity targeted multiple goals: the gross motor coordination goal, the reciprocal engagement goal, and the attention goal. But most importantly, it targeted meaningful engagement. He was regulated, he was joyful, and we engaged in something that was so meaningful to him at that time.
And you really kept that idea of autonomy, competence, and relatedness, rolled with it. I mean, I don't mean to
Oh,
no
good
pun
one.
intended. You rolled with it, and look what happened. It opens up all these other opportunities, and you were able to probably achieve more than you really expected in that
Absolutely.
situation, related to your goals and things and skill sets and things like that. So that really takes us back to those 4 actionable takeaways.
Yeah. So if we look at, the 4 actionable takeaways, one was strength based. So we're using the child's strengths and interests in the session. And this might change session to session. Humans are dynamic, we're complex, our preferences change. And this is the same for our autistic kiddos.
Mhm,
Context matters, what they ate that day matters, whether they had a nap that day matters to their preferences and their interests that day and their
mhm,
capacities that day. So it's important to kind of reassess this often. Every session. That's why that observation piece is so important because then we can see, okay, well, what are they showing interest in today in this context? And the second actionable takeaway, facilitating autonomy and choice. So I let him choose the activity instead of forcing him into my own choices. And then the third takeaway, pausing and observing before intervening, at the beginning of session. And look what that did, right? It changed our entire session.
mhm,
And then the fourth takeaway is modifying the environment in that way. So what we ended up doing actually is moving outside and playing with the balls outside on the playground because we were able to that day. But even just purposefully keeping those bouncy balls in the corner for him and removing distracting toys and equipment was really helpful.
mhm. Yeah. No, it's interesting. I'm hearing you talk about this strengths-based approach. I know Christy Patton, I think she's the one who authored the chapter in the Pediatric Frame of Reference book. She was also the Sligo lecturer and talked about this a couple years back. It was extremely powerful. Um, but what I'm realizing listening to you talk about this is that um, as OTs, I feel like it's a strengths-based approach for us.
Mm,
It's actually capitalizing on the things that are our strengths, right?
totally.
We do have a superpower of being able to see the strengths in these children. Where everyone else sees the deficits, we see what they're able to do. We also are really great at using the environment. We are really great at building that attunement with others and that therapeutic rapport. So this is actually strengths based for us. So you kind of you don't even realize that until you start thinking about it. You're like, wait a minute, this is a strengths-based approach for the child, but it also is our strengths-based approach for what we're good at as well. We can lean into that.
Absolutely. Yeah. Dr. Patton was actually my pediatrics professor at NYU in grad school. And yeah, she changed this is where I learned about the strength-based
Mhm.
approach, and my life was changed. I owe so much to her and what she taught me. And yeah, I'm a full convert into strength-based neurodiversity affirming practice now, largely because of her.
Yeah, I can
But
see why.
yeah.
Yeah, she's fantastic. So, you know, to wrap this up, we've been talking about all these different things um, that I think are very powerful for listeners. I know I'm definitely kind of really getting excited thinking about it. How can you help others be pediatric pioneers for neurodivergent kiddos?
Yeah, I mean, I feel like I sound like a broken record, but focus on meaningful engagement in every client you're working with. It's so important to focus first on connecting with them and having meaningful interactions, and just, yeah, be fully present with every one of your clients. And that means with our pediatric clients, having fun with them and experiencing that joy with them.
Mhm.
I think often we can get down to the wire and we can really be focused on the outcomes and facilitating the goals that we've set for them. And all that, of course, is important. But it's also so important to take a step back and to remember why we got into this profession in the first place, why OT is such an amazing field, and that is engagement in meaningful occupations, right? And so, yeah, I would call everyone to just be fully present with all of your clients.
Yeah, and I mean, that's really powerful. And I think about that session you described with Matthew, right? And the joy involved, the fun, and like, what a cool gig. This is my job. Like, I'm playing with this kid. He's having a ball. Again, I go with the puns again. I'm having a ball. And I'm sure if his parents are present, or a parent is present, they're super excited watching this. And I'm curious too, do you engage them in the process at some point too, so that they're able to then carry this over at home?
Yeah, absolutely. I think that's such a huge piece of it is that parent education and even just involving them in the session. I love it when parents want to come back to the sessions, and I definitely recommend it.
Mhm,
And sometimes, if there's a chance for them to at where I used to work, there was a window with the screen so they could see the session, but the children couldn't see the parents. So they could still be involved that way too, but I would love it when just bringing them into the room in general and involving them. And yeah, like for example, with the session with Matthew, the mom was so happy and so you could tell she felt so much hope, and she said, like, "Now I know what to do with him at home. Now I know how to capture his attention at home." And, so often as parents too, they can be really caught up in getting their child to do the next thing and transitions and, following directions and all of that. But again, if we show them too, the parents as well, how to meaningfully engage with their children and how to identify what their meaningful occupations are, it can really open up just a world of opportunity and connection.
mhm. Well, thank you so much, Sharon. I mean, I know you've given us a lot to bring into practice. I know you provide a lot of great resources for everyone as well. But that's all the time that we have for today. I do want to thank you, Sharon Eva, for all your insight and the practice takeaways that we have related to neurodiversity affirming autistic play. And
Yeah, thank you so much.
yeah, thanks everybody.
Thank you for tuning in to this episode of Pediatric Pioneers by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and complete the quiz for this episode. Pediatric Pioneers also listens to you. If there is a particular practitioner that you'd like to hear from, or if you have a question or challenge that you'd like to explore on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcast at medbridge.com.